Hey guys, Shaman here,
Chris.
Chris from Harbor Therapy, and are we still doing the man cave thing? Are we?
I don't know. We're getting more official now. I think we're out of the cave and into the office.
Right. So we're into the man office today instead of the man cave. But we're here to talk a little bit about A.R.T. today, or Accelerated Resolution Therapy, right?
Absolutely.
So what is it?
There's a lot of misconceptions, but A.R.T. it's an eye movement based therapy.
Right.
Okay. There's lots of research and data out there, so it is empirical. It's data driven. Okay. But it also adds a lot of creativity. So it's kind of a different approach. It's procedural, okay? So there's a process to it. There's a beginning and end of each session, okay? And there is just, again, different protocols that you follow for different situations.
Right.
With the focus of it really being trauma, okay?
Right.
And it's just different because it's not EMDR. It's not hypnosis. You don't like clap your hands, move your hand back and forth, and someone's going to be quacking like a duck.
And it's not voodoo, right?
It's
like we're not waving chicken bones.
If it is, it's voodoo that works.
Right.
But it's a mindful approach that takes into account the mind, okay, and the body, and that the body keeps the score for everything that happens in the mind. That's one fundamental. The other one is the whole concept is keeping the knowledge and losing the pain.
Right.
We all have situations in our life that create distress or problems.
Sure.
Okay? And we want to have that knowledge, but all of a sudden when we think about it, get triggered, or have a similar circumstance, we don't want to have to react to it anymore.
Right.
Okay? So it's kind of a process that creates new pathways to old memories.
Okay.
So you're training the brain, actually, is what you're doing.
All right, so that's a great segue. So how do you do it?
Okay, there's 3 requirements, and they're relatively simple, okay? Number 1 is you have to be able to move your eyes back and forth, okay? And if you have astigmatism, if you have vision problems, if you wear glasses, it still works, okay? Because the key is it's smooth pursuit. It's moving the eyes back and forth, which speaks directly to the brain. So that's number 1. You have to be able to move your eyes. Number 2, you have to be able to hold a thought. Okay. So
that takes me out of it.
right. And when we say that, okay, it just means you need to be able to focus. You need to be able to hold a thought. Okay, while you can have distress or distraction, okay, it kind of addresses your capacity to be able to function.
Right.
Okay, so move your eyes, hold a thought, and the third one is the complicated one. You need to be motivated. Okay,
So you have to want it.
Not only do you have to want it, okay, and that's a big part of it, but you have to be willing to let go of guilt. You have to be willing to let go of some of those things that maybe define yourself.
Right.
Okay. And when we know with trauma, we know with anxiety, we even know with OCD, okay, some of those things that we do and do repeatedly define us.
Right.
Okay.
Right.
And it become a part of us, okay? But the key there is, and sometimes that takes a session or 2 in itself, to just work on the guilt to say, hey, who am I without this?
Right.
Okay? Once you can do those things, you can move forward. And the great thing about it is there's kind of one caveat to the whole situation. Okay, A.R.T. works, we know it, we have the research, but the concept is that if you're worried about doing A.R.T. right, you're doing it wrong. Okay, so that's where it's kind of like going to the dentist. Okay,
Right.
trust your professional, trust your provider. Okay, if you go along with the process, it's going to work.
All right, so then how is ART different from other therapy?
It's okay. Good clinical practice is good clinical practice across the board. Okay, and there are lots of therapies that work. Solution focused, DBT, CBT. You can go through the whole bunch of initials. Okay, and there are a lot of qualified professionals. There's a bunch of them. Okay, but ART is a brief therapy. Okay,
Right.
So meaning that the meat of the work is done in 1 to 5 sessions. Okay,
That's actually, I mean, from therapy world,
Super
that's
quick.
super quick.
Super quick.
Right.
Not that you don't benefit from additional sessions afterwards.
Right.
Okay, but the meat of the work is done in the initial 1 to 5 sessions.
That's
okay.
amazing.
Yeah, it is amazing. Okay, and it's less reflection and more direction. And what I mean
Right.
by that is while emotions are important, okay? We're speaking to the brain on a different level. We're speaking to the brain at that primal level where there's images, where there are sensations, where there are feelings, okay? And we're kind of going right there. So it almost takes a little bit of the language out of the equation, okay? And what it does is it disables you. You don't have to go through the problem over.
Right, you don't have to like be re-traumatized
and rehearse it and
right.
talk about it and explain how you feel about it and why you acted this way. Okay, it eliminates a whole portion of that process.
Right.
Okay, so relief is faster. Okay, so there's fewer sessions and there's more progress. The other thing that people will tell you, okay, is that they feel it working immediately.
Right.
Okay? At the end of one session, you're just like, wow, I just feel different. I feel
And
good.
I mean, we hear that over and over and over. And A.R.T. here is like, it's a mainstay of our practice. Like,
Absolutely.
All of our clinicians do it. It's a major tool of many tools used here, but it is, I would say, it's probably one of the focus tools that we use as a practice.
There are very few sessions that I don't use A.R.T.
Right.
And what I mean by that is I do mix in different approaches along with it.
Right, because it's a tool like a lot of other tools.
And it's just a quick and effective tool that works.
Right, right. All right, so given this COVID kind of world we live in now with, virtual sessions and some sessions in the office, can you do this virtually?
Sure. The tough question, okay?
Sure.
And when I say tough question, I don't want to avoid it, okay? Can it be done virtually? Absolutely.
Right.
Okay. However, dependent on the situation, that's something that it is best practice that I'm going to encourage you to call for a direct consult.
Right. So it's case by case kind of.
Case by case. We'll talk to you. We'll explain the process. Okay. And it's just one of those things that we want to be safe, we want to be responsible, and we want to get results. Right. So I would say yes, it can be done virtually. However, the recommendation is come and talk to us first.
Yeah, and if you want to come and talk to us, our number is 813-434-3639. And thanks a lot, guys.